Mic, Bismillah. Mic testing. Texting mic. Bismillahirrahmanirrahim. Assalamualaikum warahmatullahi ta'ala wabarakatuh. A very good morning. Salam sejahtera. Mic testing. Just a little bit reminder, housekeeping announcement for everyone to ensure the comfort of everybody. As usual, they will tell you to silent off your phone because we don't want the disruption. And then the second announcement is to say to remain seated, stay calm, enjoy the presentation. Beware of the nearest emergency exit in case of emergency, which we don't want that to happen. And during the last public lecture, there will be a question and answer. You know, sometimes we are very eager to ask the question, but let's skip the question until end of the lecture. Then we proceed with the Q&A session. Mic testing. Don't be so serious. Okay, continue chit-chatting and networking while waiting for Dr. Max to arrive. Please have a seat. We have no negara kusing today. Okay, ladies and gentlemen, a very good morning. Assalamualaikum warahmatullahi taala wabarakatuh. And all, salam Malaysia Madani, salam Sabah Maju Jaya, salam UMS Brand of Borneo, to distinguished guests, respected doctors, nurses, all the allied health professional, academicians, students. Ladies and gentlemen, it is my great pleasure this morning to welcome all of you to first and ever Syarahan Utama, a public lecture entitled Advances in Wound Care. Basically, it is a meet and greet session between Malaysian Society of Wound Care Professional, Malaysian Society of Wound Care Professional, Universiti Malaysia Sabah, and Jabatan Kesihatan Negeri Sabah. On behalf of the organizing committee, thank you being here this morning, and thank you for taking time to join us this morning. And the reason why we are here this morning is basically because we shared one important goal, because we want to promote healing, prevent complication, and improve the quality of life of the patient. So, ladies and gentlemen, before we proceed, I would like to invite Mr. Baharin Ento, the chairman of Baca at Borneo, to deliver a few words to our guests and participants. Please welcome Mr. Baharin.
Okay, Bismillahirrahmanirrahim. Assalamualaikum warahmatullahi taala wabarakatuh. Salam sejahtera. A very good morning to all distinguished guests yang berbahagia, Profesor Dato Dr. Harikrishna K.R, our Presiden Malaysian Society of Wound Care Professional, and merangkap Presiden World Union of Wound Healing Societies. Agak susah juga mau sebut, but we are welcoming Dato, Prof Dato here to Sabah. Dato maklumkan dia sudah beberapa kali ke Sabah, so I think dia bukan calang-calang orang yang menjejak kaki ke library ini. We are very menghargai Dato untuk datang ke library. And then we have yang berusaha Profesor Madya Dr. Max, okay, and then and to all the delegates and participants of the meet and greet, MSWCP, JKNS and UMS. Okay, welcome to Ruang Majlis, and selamat datang ke Perpustakaan UMS. For as you know is Ruang ini adalah, we call it event space. Ruang majlis, so any event yang kita buat di library pun peringkat universiti, we akan buat dekat sini lah. Okay, and Profesor Dato Doktor, tuan-tuan dan puan-puan, okay, saya tahu Syarahan Utama sebentar lagi pastinya padat dengan ilmu dan tema yang berat-berat. Berat bagi kami yang tidak dah berkaitan dengan medical ni, tapi ringan mungkin bagi kamu dan sangat berat untuk disebut bagi saya. Jadi di sini, if anyone feels a bit overwhelming or get a brain cramp later, I think kamu tidak akan cramp, tapi kami akan cramp. So kita ada branch at 11:50, as I know. So nanti kita akan sama-sama ke belakang untuk menjamu selera lah. And then program kita hari ini sebenarnya amat dekat di hati kami di library, dan sangat bertepatan dengan aspirasi inisiatif Baca at Borneo. Okay, for a brief background, Baca at Borneo is a continuous campaign aimed to cultivating a strong reading culture, sharing resources and elevating knowledge accessibility across the Borneo region. Okay. Ini yang kita buat adalah berkaitan dengan program Baca at Borneo. And then perkongsian ilmu kepakaran pada hari ini adalah cerminan semangat Baca at Borneo itu sendiri. Ini ia membuktikan bahawa perpustakaan bukan sekadar tempat menyimpan buku, tetapi perpustakaan juga adalah hub wacana intelektual di mana ilmu dipanjangkan untuk menyembuhkan masyarakat. Ini yang penting. Quite literally in the context of today wound care event. Okay, Di kesempatan ini mewakili Ketua Pustakawan khasnya dan pihak Perpustakaan amnya, saya ingin merakamkan setinggi-tinggi penghargaan kepada pihak Fakulti Perubatan dan Sains Kesihatan yang begitu dekat di hati saya sebenarnya. Ada sejarahnya di sana, jadi walaupun agak singkat tetapi amat bermakna bagi saya fakulti ini. And then terima kasih atas kepercayaan dan kerjasama erat dalam melibatkan perpustakaan sebagai rakan pelaksana bagi majlis ini. Terima kasih sekali lagi. And we would like to express our deepest gratitude in advance to Yang Berbahagia Profesor Dato. As not in the tentative, there will be a book donation from Yang Berbahagia Dato selepas majlis ini nanti. And then sumbangan berharga ini pastinya akan memperkayakan lagi koleksi kami, sekaligus menyokong secara langsung agenda bacaan Borneo. Okay, looking at tentative, we have a very exciting schedule ahead, especially the keynote on advance in wound care. Oleh itu, saya tidak mau ambil masa yang terlalu lama untuk buat ucapan aluan. Everyone is welcome to visit our facilities and probably enjoy some of our STEM related exhibitions di belakang tu. Lepas ini mungkin boleh pergi ke belakang tu. And then I wish you all highly productive and wonderful event. Wabillahi taufik wal hidayah. Wassalamualaikum warahmatullahi wabarakatuh. Sekian, thank you.
Terima kasih Mr. Baharinento for your warm and meaningful remarks. So ladies and gentlemen, before we proceed, it is my great pleasure this morning to call upon our Deputy Dean of Student Affairs and Community Network, Faculty of Medicine and Health Sciences, Dr. Max Molan Marcus, to deliver his welcoming speech. Please welcome.
Thank you, Madam Chairperson. A very good morning to everyone and warm greetings, especially to Yang Berusaha Timbalan Pengarah Klinikal, Dr. Abdul Jabbar Ismail of Hospital Universiti Malaysia Sabah, Yang Berusaha Timbalan Pengarah JKNS, Dr. Ledra Philip Felix, Yang Berusaha Encik Baharin Eto, Director of the Library Services Division of UMS, and of course not forgetting Yang Berbahagia Dato Dr. Harikrishna K.R. Nair, President of the Malaysian Society of Wound Care Professionals, MSWCP, and President of the World Union of Wound Healing Societies, WUWHS. Timbalan Pengarah-Pengarah HMS, Timbalan Pengarah Kesihatan Negeri Sabah, Ketua-Ketua Jabatan Fakulti Perubatan dan Sains Kesihatan, representatives from the State Health Department, JKNS, members of the faculty management, healthcare professionals, industry partners, students, distinguished guests, ladies and gentlemen, salam Malaysia Madani, salam Sabah Maju Jaya, salam UMS Bertekad Cemerlang, Brain of Borneo, and Kopi Vosian I've bid to all of you. On behalf of the Faculty of Medicine and Health Sciences, Universiti Malaysia Sabah, I'm pleased to warmly welcome all of you to this meet and greet session between MSWCP, JKNS, and UMS in collaboration with the Medical Library. We are delighted to bring together academia, healthcare services, professional bodies, and industry partners on one platform to exchange knowledge and strengthen professional networks. Our sincerest appreciation goes to the Department of Nursing and Medical Library for making this program today a success. Our faculty sees that the Medical Library not only as a center of information, but also as an important catalyst for knowledge sharing, connecting students, healthcare professionals, academics, and business partners. Ladies and gentlemen, wound care today is a rapidly evolving field. Nowadays, wound management extends beyond the selections of dressings to include comprehensive assessment, advanced therapies, evidence-based decision-making, multidisciplinary care, and the management of chronic and complex wounds. We are therefore very honored to welcome Prof. Dato Dr. Harikrishna K.R. Nair, a highly respected leader in wound care at both the international and also at national levels. We sincerely thank Prof. Dato for joining us at University Malaysia Sabah and for sharing his expertise through today's keynote lecture, Advances in Wound Care. We hope that today's program will also serve as a platform to further strengthen the collaboration between FPSK-UMS, MSWCP, JKNS, and also Medic Library. Ladies and gentlemen, there are many potential areas for future collaboration, particularly in the development and delivery of specialized programs in wound care management, continuing professional education, clinical training, and knowledge exchange. We would also see strong potential for collaboration in wound care services, where expertise from the university, from the healthcare services, and professional organizations can contribute towards improving clinical practice and access to advanced wound care. Equally important is the opportunity for research and innovation, particularly in chronic and complex wounds, advanced wound therapies, wound care technology, patient education, and clinical outcomes. We hope that such research collaborations will not only generate publications, but also translate into better clinical practice, improved services, and better patient outcomes. Ladies and gentlemen, we believe that meaningful partnerships are essential in advancing healthcare. When universities, healthcare institutions, professional bodies, and industrial partners work together, we create better and greater opportunities for education, research, innovation, and clinical excellence. Today's program also includes the presentation of a wound kit by MSWCP and a contribution of books by Professor Dato, Dr. Harikrishna K.R. Nair to the Medic Library, reflecting the spirit of knowledge, sharing, and collaboration that we hope will continue to grow. Once again, on behalf of the Faculty of Medicine and Health Sciences of UMS, I would like to thank MSWCP, JKNS, Medic Library, and all those involved in making today's program possible. We sincerely hope that this meet and greet will open the way for more collaboration in specialized wound care, education, clinical services, professional development, research, and innovation in the future. With that, I wish everyone a fruitful and engaging session, and I hope that you will gain valuable insights from the keynote lecture, Advances in Wound Care. Thank you, and have a pleasant day ahead.
Thank you very much, Dr. Max Marcus, for the warm and inspiring welcoming remarks. So, ladies and gentlemen, with those encouraging words, we shall now proceed to the highlight of our program this morning, okay, the Syarahan Utama entitled Advances in Wound Care. But before that, I would like to call Dr. Ananta Kumar Ramchandran to formally introduce our distinguished speaker this morning. So, Dr. Ananta Kumar Ramchandran is the head of the Wound and Stomach Care Unit, Hospital Queen Elizabeth Hospital. And he is also an adjunct lecturer in Wound Care, Faculty of Medicine and Health Sciences. So, Dr. Ananta Kumar, please welcome.
Good morning. Thank you, Madam MC. Firstly, good morning to everyone. Very good, selamat pagi, salam Malaysia Madani. And a very warm welcome to this meet and greet session, part of MSWCP's educational outreach program. So, today's Syarahan Utama will be given by Yang Berbahagia Dato, Prof. Dato Dr. Harikrishna K.R. Nair, who's our distinguished guest speaker and the current director of Hospital Kuala Lumpur. So, with that, I would like to welcome everyone. We are deeply honored to have all of you here, representatives from various sections, medical professionals, industry partners, administrators from MSWCP, UMS, and JKNS, and also welcome to the faculty members, students, friends, and colleagues. So, thank you for this incredible turnout. And also thank you to the organizing team from the nursing faculty of UMS. So, ladies and gentlemen, I do not want to take a lot of your time. I would like to introduce our distinguished speaker. It's my utmost pleasure and privilege to introduce our main speaker, today's keynote lecture. He is a trailblazer, a global recognized leader, and an absolute authority in the field of wound management. He currently serves as the director of Hospital Kuala Lumpur and holds the prestigious position as the president of the Malaysian Society of Wound Care Professionals, MSWCP, and is currently the sitting president of the World Union of Wound Healing Societies. Through his leadership and dedication in his visionary research, he continues to transform medical practices and elevate patient care, especially in the field of wound care standards, both locally and globally. Today, he will be sharing his profound insight on the latest breakthroughs in his lecture titled Advances in Wound Care. Without further ado, please join me in giving a resounding warm welcome to Yang BHG Professor Dato Dr. Harikrishna K.R. Nair to the stage. Dato, the floor is yours.
I think wait for the clicker though. So thank you very much to Dr. Max and also the library side and everybody who's here. Dr. Ledre also from JKNS. First thing is I think just to add on you all asked why from MSWCP and from HKL I'm here basically. The other positions that I have holding is also state advisor for wound care for Sabah state and it clearly states that it's until I pension or if anything goes wrong along the way. Okay, tapi selagi hidup lah sampai pension tu. And then the other thing is also I'm also the timbalan pengerusi for the National Committee of Wound Care for the whole of Malaysia, which has got basically your teams basically from Kesihatan Awam and also perubatan under bahagian perkembangan perubatan in KKM. And at the same time I'm also the penasihat kebangsaan for bahagian primer under BPKK and all these things. So today's session, after you finish this, all these photos will be sent to Dr. Ismuni, who is the TKPK, and also to Dato Nosia, who is the Pengarah BPKK, and also to William, who is your Pengarah Negeri. Alright, so every state usually I will send, because we all sit in the KPK HAS meeting for the main meeting in the morning. So that's the other aspect. And on top of that is my society, because why? As a government servant, I cannot give you kids. Duit ada kan? Kekangan daripada Kementerian Kesihatan Malaysia. So most of the kids, because each kid is worth about 2,300 ringgit, one kid. So you have about 12 kids over here. So with that, it says it's already about more than 25,000 plus ringgit for this. All right, so it's a bit special. And we have done it before this during Dato Yusoff's time, the first time, and also Dr. Christina Rudi's time, and Dr. Rosnaini's time also. So all the state pengarahs, we have been giving all these things before this. Okay, so that's why the kit one is very good, very, very important. So that's actually give you all some of the advanced products which are available, because not all states got. Even the letter for wound care, which was done basically on 16 October 2011, was written by me. And that's when we started the Perkeliling Baru, signed by Dato Hassan at the time, to actually start wound care in Malaysia. Then on the 23rd October 2017, we did that second letter. We can't do another Perkeliling, so kita memperkasakan perkhidmatan wound care. That was done with me and also with Dr. Noraini. And you know, basically all our conferences for MSWCP and even our International Wound Healing Foundation and World Union, we do it in Malaysia in October. That's the only time I boleh bernafas sikit. That's why all the Perkeliling also is in October for wound care. Alright? And we already done 2 manuals, and we just came back from module manuals and all that in Kelantan also that day. So that is ongoing as usual. Okay? And I'm happy that Dr. Max also a hyperbaric physician, because I thought I was the only one hyperbaric physician with Dr. Lutfi in Terengganu many years ago. That was in 2010 when we did the first time. Nobody else in KKM did hyperbarics. Okay, so we all finished that, everything on that, and I've been trying, even though I sit in all the outsourcing committees since Datuk Noremi, Datuk Latif, DG, Tanzi Sham side, all that, to get hyperbarics. So finally now we are finishing the last policy, myself, Mr. Zairuddin, and also Prof. Nick from USM. I think you know him very well. Okay, he's a good friend of mine because we did quite a number of studies in HKL, and I got for him the grant about 200,000 to do hyperbarics basically in USM last time. So kawan lama lah. So we all, you know lah, we are all in the setengah abad, past setengah abad dah lah. Okay, getting younger. Alright, so that's why what you call is wound care is a very big thing. A lot of things we have already changed and all that, and hyperbarics is the other thing. So when you all have time, come to HKL, you can see our, what you call is new hyperbaric center we are opening up. Renovations now at 55% already basically. They're supposed to finish it by this October and go to second phase and start putting in the modular, what you call is chambers and all that. So wound care also will be divided. So we have clinic, and also we have got the training education center, and finally what you call this, the hyperbaric chamber also. Okay, because all my post-basic love to go to Lumut. You know why? Lumut not so important. It's basically the team building after that. They all play dekat pantai tu. Okay? Even though we have Hat Mizan which is just nearby, tak nak pergi Hat Mizan, nak Lumut juga. Because why? Holiday and team building. So, let's look at some of the advances in wound care. Now, this one is just to show you, this additional PhDs here basically from Europe and all that, is I started doing when I was in late 40s, finished in 50 something. Alright? So that's just to tell you basically, if you're in your 50s or so, you can still study. There is no excuse. The next trip when I go to Brunei, Dato Zaleha in her 60s was doing her PhD. Dia belum buat sebelum tu dah. Alright? So I dah ada 2 PhD dah. So PhD is what? Permanent head damage kan? So you understand lah, double PhD is double permanent head damage. Okay? Where do I shoot? Okay, there. So, Kuala Lumpur Hospital, very interesting. The only hospital with 2,500 over beds, and also 13,000 staff, and 2,000 kosong. So our post is 15,000. We are bigger than Perlis, Melaka, Negeri Sembilan, Wilayah, and also Pulau Pinang. And that includes hospital, JKN, PKD, KK, all campur together. Alright? The whole of Negeri is only 11,000 over staff. Alright? So this is quite big. And I'm also the cluster head for Nam Hospital, and also sit in the governing body for that also. So with all those things, masih nak buat wound juga, because I've been doing wound for many years. It's my clinical this thing too, so I also teach a lot. I've been teaching basically for 28 years internationally and also in Malaysia. Now I would like to apologize because I bawa what they call is only I think 4 buku untuk library. There is 23 buku altogether. And then there's another 2 more what they call is books which are coming out this September next month for the World Conference. So 25 buku campur dengan Springer punya buku semua tu, which is all in e-book semua tu, and that's much is done. So these books are subsidized by society. In this same book, if you buy US ke apa semua tu, is 5 kali ganda harga. Alright? So for Malaysians apa, especially for Malaysia, is subsidized a lot. You won't get a hardcover book for 128 ringgit. If you can get for me, medical book for 128. Even your Ganong, Levine, all these things, all is basically much more expensive. It's all in pounds kan. So we subsidize a lot basically for what do you call that, Malaysia and also for the region. Okay, because we all are under middle income countries. And we also have another 16 books basically, chapters in India, in practical diabetes, in diabetic foot, in also what do you call this, in chronic textbook with surgical side also, even atypical wounds, quite a number of things. So all these pyoderma and all these things are also inside there, together with what they call this dermatological problems and all that. So quite a lot of books everywhere. You know? So, and we have a book in Italy also. Okay, another book on textbook on that. And we just published another paper in the Lancet. Publication wise, when I took over as Pengarah, the first thing I say is, what is Hirsch index? They all smile. You know why? I went to IPR, my respiratory physician, oh, Jusasi, you know, same level, VK7. So sit down there and I say, oh, this is the most published person. You know how many? 5 paper. I said, 5 paper, that's what I do in what do you call this, half a year. We try to get at least 10 papers per year. You 5 dalam hidup you. Surprising, right? What is the Hirsch index? Hirsch index means what? You publish 5 and you are the citation 5. Baru you kata 5. So you have to have at least 20, 30 ke apa semua tu, baru nampak lah people citation dia. So that day I asked my research site, CRC kan, sepatutnya ada masters in statistics. I thought they will calculate my Hirsch index for me. You tahu apa dia buat? All of you all rely on AI. They click on AI, Prof. Dato Harikrishna, Hirsch index. And state came out 24% something. I say, hello, ini baru kata saya buat apa tu 50-60 paper je. Dah 200 paper you check ke tak? So you see the AI can be wrong. Alright? That means 24 papers with more than 2,552 citations. That means people cite your work, It's no use you kata, oh, Max is handsome man. Oh, he is the main man dekat sini. There must be another few thousand people telling, yes, he's the one. Kena cite. If not, you sendiri, short sendiri. Betul tak? So wound care, if you all think basically it's just dressing saja, nothing else ke apa, every single dressing has got papers. You look at the National Health System, you look at basically what NHS, you look at what they call the NICE guidelines, the National Institute of Clinical Excellence. You look at the IWGDF guideline, International Working Group for Diabetic Food, run by Professor Fran Game. Professor Fran Game is the Vice President for DFO International. Alright? I'm the President now. So I review the IWGDF document fees for the world every 4 years. So next year dekat Hague, 2027. At the same time, we also have pressure injury prevention guideline. International, 2019, the last one, the latest addendum last year. I am also involved inside that. That's why I can tell you all the international papers looking at wound care basically, memang ada cukup evidence. Alright, you ask Dr. Dina basically, she will know. She finished her PhD sekarang semua tu, she will know. The amount of papers that she has to baca untuk muntah darah. It's a lot. It's not this one. And doesn't mean wound care tu hanya wound care saja. It covers from top to bottom. You need to know basically after a lobectomy how to heal the wound. After syringomyelia at the back, pediatric cases. I even gave what they call spina bifid, how to go and manage basically the wounds ke apa semua. It's not bukan satu lubang, tengok tampal satu benda, happy, saya balik, dressing akan buat kerja. So that one basically memang bukan lah. That's why I'm touching advances sekarang, because give you the basics tu. Bahawa there's a lot to learn. Even dekat umur saya tu, walaupun masters PhD 2 pun tak cukup lagi. Sekarang ingat nak buat lagi PhD 1 lagi. Tapi takut pula apa tu, DG told me tadi, 2 ke? Ayo, berhentilah, cukup lah. Dah cukup pandai dah kan? Tapi kata tak cukup, bukan tak cukup pandai, lagi banyak nak belajar. That's too much. Okay? So if you look at this basically, if you look at because we look at the Western Pacific. So Western Pacific is here. So we are covering this region basically. Okay, battery tak kerja, tak apa. So Western Pacific is this region, alright? So this particular region itself, you see you have got 103 million. So you have got a 15% increase in diabetes. And who is the jago in diabetes? Malaysia. Why? 20% more the age, above the age of 18. 30%, 35% more the age of 30. So we are the highest, but yes lah, we say, no, kita ikut daripada lahir. So kita kata kita 16.8, then 17.3. Hello, how many of them are from lahir? Most of them from 18 kan? Adult pun cukup dah. That's where the main diabetes, type 2 diabetes and maturity onset of diabetes in the young. MODI. So all these are very common. And makanan kita sedap kan? You pergi, I don't know whether you all pernah tak, I've gone 2 weeks overseas tu, I pergi Europe dengan US, bila balik-balik, the first thing I datang tu, I don't ask, I nak jumpa wife I tau, dia datang angkut saya tu, I kata tak apa, you datang ke tak kisah, driver datang pun tak apa, bawa nasi lemak tu, sambal banyak sikit, saya makan dalam kereta sampai ke rumah, tak nak tunggu, alright, because the sambal overseas is pathetic, betul tak? I tried one time, I makan the Mexican punya jalapeno macam tu aja, sebab tak pedas langsung, dia punya makanan pedas tu akan kebaskan mulut, itu je. Dia bukan macam malah kan. Malah habis, dia bakar terus saraf tak bekerja. Alright? Tapi what to do, the youngsters all love that. So you see our numbers are increasing basically. And we find that 5% have history of food ulceration, more 25% cumulative incidence. Which means you already have about 5 million people sekarang yang ada diabetes kat Malaysia. And at least 25% akan dapat diabetic food. So you have 1.25 million. So you tak payah pencen. I told my wife dah, I tak payah pencen dah. After I can continue working. So you can buat clinical berterusan. And teaching and training and all these things all. So we'll continue working, they takkan stop. And then if you look at Asia also, it tells you 5.5% adults. This is all very conservative ones. Think about it, 50% of diabetic patients don't even know they got diabetes. Until mata dia buta, glaucoma, check sugar high. How many of you checked sugar in the last 1 month? Angkat tangan. Nobody. I rest my case. Nampak kan? You're all medical personnel. Not even one person checked in the last 1 month. You're waiting for something to happen and then check. That is the Malaysian story. Reactive. Betul tak? Alright? No need to go far lah. Ini bukan nak cakap apa-apa kan. Sama juga. Tak ada orang check pun saya punya clicker ni. So tadi tak keluar merah dekat tempat tu. Tapi saya dekat universiti. Betul tak? University should have kan? So it's macam tu lah. I say basically, you all must check. sorry, I bring the code salah. Biasanya I punya code ada one clicker myself punya. Senang, so I tak bawa tu. So I'm just saying lah, that's the thing. Because I mean, I cakap direct, I tak cakap belakang. Tak cakap, UMS, saya pergi sana, clicker pun tak jalan. Semua tu lepas tembak muka dia pula. I tembak dekat sini, tak jalan pula. Okay? Tak, basically what they call this is just to say, that means you must check everything, make sure everything is all there, ada ke apa. Because you nak naikkan nama universiti. So for Sabah, basically you have a lot of campus, apa semua tu you kena buat. Takut VC datang tu sama juga. Alright? Tapi kita semua baiklah, kita tak marah, kita kata okey je, kita teruskan. Tapi just to show as a contoh tu, macam even checking gula pun you all check. By right sepatutnya I check dulu, baru you all bagi makan nanti. Jika tak nanti bagi makan lagi kan? Pagi makan, tengah hari makan, 4 hourly feeding. Alright? That's very common. In most universities, saya pergi pun sama juga. UIA pun I'm also in the Board of Studies. Alright? Last time Perdana pun sama, I was in Board of Studies juga. So every place ada Board of Studies 2 tahun. Tapi bukan Board of Studies for faculty saja tau, for the whole university. Lagi besar. Alright? So quite a lot of things lah basically yang kita tengok semua tu. So most of them, even in MMC pun quite a number of them are there. And you see the control of sugar, basically. Look at our Malaysia ni, diet care, adapt semua tu. 22% aja 6.5% below. 78% ni sedang makan apa? Semualah umai lah, midin lah, apalah, semua tak apalah, itu okey. Tapi campur dengan nasi banyak-banyak, pagi nasi, tengah hari nasi, malam nasi. If tak ada nasi, kata apa, saya makan kuih tiaw. Itu karbohidrat sama lah. Benda sama kan? Katakan manusia datang, dia laki ke perempuan, dia manusia juga. Alright? So you're still eating, so it's more 22%. And then every single time bila you pergi, there is sugar. Malaysia is the only country yang boleh ada sugar shortage. Never happened in the world. I've never heard. Only country, not even in Somalia or Ethiopia, di mana tak ada makan, tak ada apa pun, there is no sugar shortage. Malaysia boleh. Don't worry, you all go to Philippines nanti tengok. When they sing the song, habis semua tu, look at me and say, Prof, Malaysia boleh. Kita boleh untuk all the wrong things. Renal failure number 1, obesity number 1, diabetic percentage number 1. Why we don't look so much there basically is because of percentage, and we are only 34 million. Compared to India, which has got 1.4 billion. So nampaklah, wah, beratus juta dekat sana. Oh, you teruk semua tu. Tapi percentage India is less than us. Kita hanya kalah kepada satu negara saja, which is Arab Saudi. Dia punya lamb mandi kebanyakan. So semua orang makan sana, masa I tengok pergi untuk haji, umrah semua tu, lamb mandi. Nasi penuh, lamb in the center. And habis tau. Tapi dia tak check gula selepas tu. 2 hours post-prandial. Okay? And a lot of our people are there basically who are having a lot of problems. So we did this on diabetic food ulcer care in the Asia Pacific region too. So this is a consensus document. So you think of multiple countries inside there. Thailand, India, Philippines, basically Sri Lanka, Vietnam, China, and also what they call this Taiwan and Korea and all that. So we did another guideline. So a lot of guidelines for you to baca. A lot of things to actually go. I won't go through this because dia 40 lebih muka surat. Okay. This is therapeutic wound cleansing. So kita ada International Wound Infection Institute. The job is to look at basically infection. So 2016, 2000, what they call this, 22 and 2026 tahun ni, we actually came out with all this. Alright? So this one is basically the wound infection continuum. That means to look at it as colonization, contamination, colonization, local infection. And then spreading infection, systemic infection. And under local infection, we got overt and covert. So that's how you look at the wound itself. So all that actually has been published and actually presented semua tu. So this is one. And we have therapeutic wound cleansing. All of you are using a lot of barang-barang now kan. I tengok terbaru sekarang ni semua orang pakai povidone. Saya 28 tahun suruh cakap jangan pakai, dah pakai balik povidone lagi. I'm sorry to say lah, tohlol mana yang mulakan balik. Because the therapeutic index for povidone is low. Therapeutic index mean basically, that means in terms of safety and efficacy versus dengan dia punya detrimental causes, irritant or any of these other problems. It actually has an effect on the fibroblasts. So you ada basically octanidine, you ada what they call this polyhexamethyl bigonite, you ada what they call this Q-Heal, APPL, approved product list, dah buat untuk you dah. Superoxide solution bersama dengan nano copper solution. You ada 2 solution yang boleh ambil melalui APPL. Bukan duit you pun. Apply kepada pharmacy, pharmacy will supply to you. Betul tak tadi dia? Who is the one who did that? I tak boleh cakap lah. Sebab akta rahsia kan, kita semua sign. I cannot tell you who did the thing. Tapi dah KKM, we know lah, I'm the one who put inside dalam tu kan. Tapi after that, basically tiba-tiba I dah tahu, on the flight here, someone was telling me, Dato, kita dekat Sabah sekarang, kita bagi povidon ke patient bawa balik rumah, buat dressing 1 tahun dengan povidon. I nearly had a heart attack. Nasib baik, nobody came and did mouth to mouth. Dia dapat buat mouth to mouth, pingsan saya. Alright? Sebab dia pecahkan rib lagi kan. Very common basically. So that means basically you all have to look back tau dengan what you're doing tu. You're going backwards. If you want to give povidon, orthopedic dulu pun semua povidon. Everybody packing. Ear packing, povidon. Nose packing, povidon. Semua povidon. After that, what happened? All the wounds take long time to heal. You have a lot of advanced dressing. Povidon is only a cleanser. Dia bukan dressing. Dressing, actually we already put one more in APPL. Iodosop, cadexima iodine. Dah ada dah. So sebab itu one of the other reasons why I came lah. I'm hoping what they call is UMS yang, what is it, bijaksana and brain of Borneo kan. So the brain of Borneo must whack the other brains which are not functioning. I'm sorry to say that. I'm very direct. Because I deal dengan your bosses and all that in KKM semua tu. So I akan beritahu direct ke dia. Dia kata, pergi sana nanti tercangang. Ini I akan beritahu KKM, tunggu. Kita suruh berhenti povidon, kita bagi APPL, semua pakai povidon pula balik. I nak cari siapa yang buat tu. Nanti Azmi tengok, Samsul semua tengok balik, siapa yang pakai tu, bagi nama kat I suruh datang jumpa dengan DG sekali. There'll be a good thing what they call is they can present. They are quoting what? 1 paper, 2 paper yang kata bagi hello, when we do this one macam ni, we have 80-90 papers yang kita tengok. Masa kita kata povidon boleh guna tu is actually yang dilutional punya povidon. Itu pun basically 44 papers kita tengok. Bukan satu paper. Satu paper you must see macam what they call is, you all are university kan, level 1 evidence, level 2, level 3, level 4. Level 5 is my evidence. I cakap okay lah pakai ni. Itu key opinion leader. Tapi 4 dengan apa semua tu is case series, case score. You need to go to randomized control trial ke, double blind trial ke, Cochrane review ke apa semua tu. Okay? So ini juga berceloteh sikit supaya you all tahu banyak benda dalam wound ni. Okay? Now, the other one, this is the one I mentioned just now. So you have contamination, collision, local wound infection too, spreading and spreading. So this one will be launched, the latest version, dalam September ni. 2026 punya version tu. Alright? And then I'm also sitting on that board. And then kita ada use of wound antiseptics. That's why you nampak the first few sessions I punya nampak all on wound antiseptics semua tu. Because that is the main cleanser. Jangan pakai normal saline saja because MRSA Surumonas akan tumbuh dalam tu. So you pakai water for irrigation. Only one country in the world I benarkan pakai normal saline. Maldives saja. Because bila I train Maldivian Association of Surgeons for 4 tahun tu, dia punya government, dia punya dia punya water for irrigation atau distilled water is kecil macam ni. Dia kena buka 20 macam ni untuk cuci. Dia hanya beli normal saline aja. So kita dah ajar dia sekarang tukar balik semua tu. So they already have a lot of advanced antiseptic semua tu. Dr. Wahid and team semua tu. And Dr. Wahid pun sebelum ni general surgeon saja. Akhirnya nasib baik I managed to get for him a 3-year this thing dekat Siraj Hospital where I'm also visiting professor. So dia terus sekarang the first plastic surgeon of Maldives. Okay, so he'll be here next month juga. And then basically you see, if you look at this, now all these clinical signs are important when you look at this part. Whether it's actually red ke, ada inflammation ke, ada bleeding ke, apa semua tu, is there any smell change, any pain ke, apa semua tu. So a lot of things on assessment, like what Dr. Mark has mentioned just now, Dr. Max has mentioned just now, assessment is very important. Assessment pun banyak. There's a lot of what you call is concepts on assessment itself. Alright, show you Thailand balik. Why? Cantik semua tu, dia masih renovate juga. So kita yang what you call the brain of Borneo pun, our brain of the earth sekarang, Einstein is supposed to be the one using 10%. Kita semua 7, 8, 8.9, 9.2 ke apa, tak sampai 10 lagi. So this is the best time to do more renovation tu, penaik tarafan, memperkasakan, menambah baikkan you punya brain supaya naik kepada 11-12%. At 90% you dah boleh terbangkan semua orang. That is what they say, the amount tu. Okay? And then you have got another consensus document on wound balance. So when I was in Munich, we actually did this particular consensus document. So this document basically looks holistically in terms of patient care itself. Alright? So we look at basically wound care, clinical care, and patient care. Alright? So it's a holistic approach to cover all aspects. And it's a new global one. Also will be launched during the conference. It's a World Union of Wound Society's consensus document. So wound care, basically you can look at biomarker status. The biomarker status basically looking at the MMPs, looking at macrophage regulation, M1, M2. Okay, I don't want to go too high. Last time I pergi plastic surgeon, I went too high, all diam dah semua. Quiet aja dekat MAPEX last time. So the other part is basically looking at oxygenation, TCPO2, trauma, comorbidities, everything. And then patient-centric. Alright, look at the patient. Health-related quality of life. Now, all of you all duduk dekat sini kata, bila dah habis ni, kita dipaksa datang hari ni. Dapat kit satu orang je. Sekejap bagi je kit, kita balik teruskan. Dia pagi tadi tak bagi makan pun. Terus duduk. Lepas tu orang tua ni dah botak pula, cakap banyak pula. Betul kan? So half of you are thinking of that. The other half is, hari Jumaat. Besok Sabtu Ahad cuti, Isnin cuti lagi. Siapa nak pergi ke bahagian Merdeka dekat depan dengan dekat Hilton sana kan? Sebab nak pergi semua. Dah ingat dah kan? And some of you tengok, lauk malam ni macam mana? Apa nak masak? Betul tak? Because your retention is only 15 minutes. After 15 minutes, you will start to wander. And that's clinically and medically proven. Okay? So sebab itu what they call is, don't worry, I won't shoot too long. Okay? So next what they call is clinical care. Because they gave me 50 minutes kan? So kena berceloteh sikit. Sepatutnya ambil, this lecture can take 2 hours pun. Tapi this lecture can finish in 20 minutes. Yes. It all depends on how much to impart. Because most lecturers, after a while, we don't put everything inside. Everything is here. Your CPU kena kerja lah pagi tu. So kena ada kopi lah. Dah minum kopi okay tu. Alright. Clinical care basically is looking at your time management, all that. It means it is not that you heal a wound in 1 year. For a diabetic foot ulcer, within 4 weeks, there must be 50% improvement in terms of area atau volume. So that it will close within 3 months. Not 3 years. Don't say, finally saya sudah tutup luka tu selepas 3 tahun. By right, bukan macam ini. Macam ini. Because should be only 3 months. You buat 3 tahun? The resources, the things, apa semua tu, you simpan patient tu. Dia tak ada offloading, dia tak ada what they call this, proper footwear, orthosis, insole, semua tak buat. You bagi ubat, tempek dressing, itu saja. Tak boleh. It's a holistic tu. Don't treat the hole in the patient, but treat the whole patient. Manusia kan, pernah datang ke sana bagi one kaki tu, ini kaki saya, you buat dressing, saya pergi kundasang dulu, saya balik bulan depan. Adakah? That same manusia is coming to you. So you have to treat all of them completely. So let's look at some of the advances ini. Alright? So we basically look at, this foot. Senang aja, nampak kecil je, tak ada apa banyak. Alright? So then basically tengok dia punya perfusion. So we use a $1.2 million machine. We check the perfusion. Nampak what they call is the blood supply. Dekat tempat tu aja. Lain-lain tempat semua the blood supply is not very good. So we actually use adjunct therapy. Adjunct therapy kita pakai microcurrent. 10 to the power of -6. So bila you buat post basic, you akan learn that particular machine semua tu. One machine is about 28,000. Alright? And then when you do, you actually increase, nampak, 173%. So you increase perfusion. Now, vascular surgeon very senang. Diabetic foot, vasculopathy. Medial lumen disease. So blockage dekat popliteal, femoral, basically dia boleh buat. Tapi what about dia punya normal capillary perfusion? Nobody can do anything. So what they say? Potonglah. So we have a patient yang kita publish, we did a 100 patient trial first untuk ni and confirm that it's effective. Then we did one more dengan the assessment here where we can show immediately the increase in terms of perfusion. And then we did one more 96-year-old Chinese lady. Supposed to potong kaki. 96 now, you potong kaki, baru you hantar dia terus kepada tokong mana-mana and say bye-bye. Booking dulu terus, sure mati punya. Alright? Luckily the anak is 60-something years old, dah pencen, she started using microcurrent 3 times a day semua tu, increase the perfusion, cut down the inflammation. Both auto and vascular kata potong. Kita selamatkan. Alright? And that was published as a paper juga. And that patient still datang selalu every time tu, dia bawa je mak dia ke sana, okay, hello doktor, apa semua tu. Dah lah nyanyuk sikit kan. Okay? Tapi what they call it, she's still alive. Alright? 96, she should be about 98 now. 98 ke 99? Okay, same thing, this one. Letak skin graft dekat plantar aspect. Orang tu akan jalan pula tempat tu. So what do you do basically? Tengok dia blood supply, sini saja. All this will crack, dapat luka lagi balik. Okay, so you have to increase the perfusion. So other advances imagery basically is you pakai katakan, first one of the ones we did in Sabah, during Sandakan East Borneo punya one, many years ago. I think 15-20 years ago. That time basically we use what they call is the tablets semua tu. So wound dog is something coming from Canada and China. We used to use tablets, sekarang kita pakai handphone. iPhone dulu, sekarang Android dah. So it will basically dissect the thing, give you what they call this, the reading, tell you how much of epithelial tissue, granulation tissue, necrotic patches, and also your slough. Alright? So you need proper lighting apa semua tu. Then this is Aran's camera. We did a study with beta blocker creams, everything all that, using Aran's camera. Harga dia 33,000 satu Aran's camera tu. It's laser guided. So what happens basically is, this is the one. You angkat, it dissect and take a photo. And basically like this. Alright? It gives you the photo. Then we have got the other inside one, which is coming from Korea. So this Korean one is also using a tablet. So what we did with Devung, we actually did. Because I did 2 projects in Sabah, Sarawak, we did the Halim Foundation punya untuk burn semua tu. And then in Sabah, we did the study dengan Devung punya projects. So we actually gave you a lot of consumable at that time, many years ago tu, untuk ambil gambar dengan tu, they can see, like this. So you know the wound is over this area, it's a pressure injury basically, this is the area measurement and the volume measurement. So you tak payah macam sekarang ni, you take your ruler, ukur, and then ukur this ruler here. Then after that, this today morning, what they call is, Deborah ambil gambar. Then bila I datang round tu, dia kata, Prof, sorry Prof, bukan Deborah, semalam Sandra. Deborah tak ada semalam, dia cuti bersalin. Then you panggil Sandra pula tak jawab phone. So you do what wrong, tak tahu pula. And then all simpan in their own handphone. Pernah tahu, I selalu simpan kan. So apa jadi, I nak tunjuk anak I, tiba-tiba boom, keluar luka. Lepas tu luka dia, macam tu pula. Tapi dia tunjuk gambar anak you. So I ada lebih kurang 19,000 bukan, 199,000 gambar dalam phone saya. So every time I beli phone, I kena tambah extra, what they call this, dia punya, SIM for storage. Alright, so tambah normal storage, itu dah tambah dengan card extra for storage. So I akan dapat yang ada 2 card tu. Alright, so multiple tu, because always sampai ke mega giga dah. Alright, back to this again. Now, the other part, let's look at infection. So kita bagi sekarang nano copper. It's a bit more expensive tapi APPL. Why you worry? APPL not your money. 1.6 billion kita letak for all products, wound apa semua tu. You'll be surprised, we sat in the committee meeting for how many times tu, duduk, tengok tu, marah-marah, maki hamun semua orang semua tu, sebab bagi sampel 1 biji. 1 keping suruh you pakai ke apa semua. And then we have to choose which one to go and use ke apa before it goes to the tender board chaired by KSU. Okay? So basically when we went through that semua tu memang susah because this time kita tak bagi Famaniaga. Famaniaga logistik saja. So bahagian unit sumber perubatan KKM yang buat, Leda will know. Okay? So Kashful punya bahagian yang buat all these sections semua tu. So we at the committee level so we'll be doing all these things. So let's say look at nanocopper semua tu. This is moleculite. 25,000. Satu aja dekat Malaysia, dekat HKL. Lain semua tunggu saya untuk bagi untuk hadiah mas kahwin ke apa. Alright. So this one can actually look at different types of wounds. Then we use copper. Nano copper sekarang APPL tu dia mahal sikit tapi kita guna ni. So bila kita tengok yang tu semua tu, this is actually the thing. But I've been using this for 6-7 years sebelum ni. The first time kita dapat tu is just a concentrate which we actually just put in about what do you call that 1 cc of concentrate with 500 ml of distilled water. Campurkan sekali semua tu and then use it at that time. Now they have already done it for you, so make it more better so at least it's not it's sterile lah, and the stability is there. Okay, so we looked at what they call it about 10 patients, the first study tu, and this is the molecular showing you green color. You nampak ini, you think basically exudate saja, tak payah antibiotik, tak payah apa, tempek aja dengan melolin hantar balik ke rumah. Bila tengok ni full of bacteria. Bila pakai nano copper, immediately after cuci ni, nampak beza dia. So when my patient ask for ubat, I kata bawa molecular. Scan. Hello pakcik, nothing there. You want antibiotic ah? Tak payah. Makan what they call this, no sugar punya gula-gula. Sebab diabetic kan. So same concept. So you don't have to give antibiotic. If not everything is antibiotic. So you pakai molecular, real time mereka bagi you. So you just cover the place, make it gelap. Take a photo. So if let's say if it's reddish and all that, basically then you talk about bacillus. If dia cyan ke apa, cyan lah. If you talk about greenish ke apa, most likely infection. So, it's bacillus basically. The reddish is cocci. Bacillus means Pseudomonas apa semua tu lah. So it shows you straight away that thing. So you can see the improvement. So after this 10 patient thing, we did a 300 patient trial. So 300 patient trial also we saw the improvement. After that baru kita masuk APPL tu. Okay. Sebelum kita pergi holiday lah. Okay. Nak pergi Sutra Pacific, pergi jalan ke apa, buat island hopping semua tu. Dah pernah buat dah. Sebab I have done a conference here in Sabah many years ago. North Borneo Conference. Okay, kita buat and that time was quite packed. Okay. This is the bapa for wound care, George Winter. Tapi dia tak ajar apa-apa ke you. Dia just ajar you maintain moisture under a semi-permeable membrane to allow the re-epithelialization of wounds. Yang you all semua tahu. Pokok-pokok bunga semua you tuang air kan? That is to maintain the moisture. You also put moisturizing sunblock for yourself. Foundation with moisturizer. Everything sekarang. Bukan perempuan saja, laki juga. Tak percaya boleh jalan ni satu orang show ada. Okay, tapi dia pastikan tak oil sangat lah. Sebab the newest Gen Z punya style is apply things on your face that people will not be able to notice that you did anything to your face. Betul kan? Pakai the tracksuit and after they go out. See, what do you do lah? 1 hour inside there buat tu. Tapi lambat. That's why. So problem tu. Alright. So, this is calciplix, which is actually RGTA, heparin sulfate mimetic agent. This particular agent too is actually from what they call that France. Now, what happened is we look back at the extracellular matrix too. So usually you have got all these proteoglycans. So extracellular matrix is from the skin. So you have 148 molecules. So we take one molecule out. And this proteoglycan is the one that is a barrier protector and regenerator semua tu. And that is the one that is a problem. Okay? So basically you see this is the connection of the extracellular matrix for the skin. Now, all of you all will not have this effect until you dapat luka. Okay? Once dapat luka, barulah menangis. I'm hoping that you will get luka. Bukan sebab saya jahat ke apa semua tu. So, you dapat luka tu baru tahu kesan dia. And then you can tahu, manusia ni buat dressing to you, binatang tu buat dressing to you, siapa yang betul-betul buat dressing. Alright? Different. And dressing means not just template dressing saja. That is the most basic. Nowadays, a lot of places, you got doctors, whatever, who are doing all those things. So don't think it's just dressing, basically, you just dress, cleanse. So you need to, yes, there is another guideline, wound hygiene. Cleanse, debride, refashion the edge, and then basically dress the wound with an anti-biofilm technology. And then you have assess, manage, monitor. And then the new one that came out basically is the continuous debridement, integral debridement basically, CID, which is cleanse, debride, cleanse, debride. Cleanse first, debride, cleanse balik, and then debride. Sama macam you punya pinggan. Cuci dengan air dulu, bilas dulu, letak sabun, scrub, semua keluarkan balik, cuci balik. Betul tak? So cleanse, debride, cleanse. Alright? And then baru you dress. CD. Okay? So that is another one that we have done. And now we are basically doing another paper sekarang ni dengan Journal of Wound Care, where we are looking at what they call it CID ni as an application process for Asia. That means in terms of cleansing, basically debridement, cleansing, and then finally dressing. Okay? So what happens basically with heparin sulfate proteoglycans is they are scaffold and also for cellular cell signal regulation. So these are the parts which are actually active, and all these are degraded. So inflammation breaks down all these sections. So that's why you need to basically cut down the inflammation. Alright? Break down the cells, so connection. So the wound doesn't have to heal. Alright? And then you find basically you need to actually have this kind of mimetic agents akan bantu. And this is from France. Alright? So this calciplix which we use basically, it gets back the connection jadi balik semua tu. So IGTA basically cross-links the protein fibers. And then this is a publication from Dennis Barreto and team. And then what we don't have in Malaysia, I'm hoping that UMS will do, because if you have time and you have got a hospital UMS, nanti we'll speak in the afternoon semua tu, basically to do as a cost-effective costing. Overseas tengok nampak 74 euros for the whole wound to close, which is very cheap. Alright? Dekat sini kita buat dressing tapi you all tak kira, because you all gunakan prinsip RM1, RM5, RM3. So after the 153 punya singgit tu, you tak tengok pun that RM1, RM5, RM3 is actually what they call it subsidized. So harga barang, oh saya beli dengan LPO, saya beli dengan APPL. You kira all of those and see basically we're using a lot of money, spending millions, billions basically. We did that particular study in 7 hospitals at the start, 2009-2010. We found out we actually got about 1 million for that 1 month tu in 7 hospitals saja. That time tak ada barang macam ni, much lesser. So within the 7 months, 7 million habis. Okay? That's why now you find that under KKM, we managed to get for you 7 million under all the perubatan side for all the hospitals. And then we managed another 9 million. So recently I just checked BPKK before I came here, 9.1 million sedang digunakan for all the FMSs apa semua tu for under LPO. And then APPL is separate. So this money is still there. At the same time, all hospitals also get Modal Insan money. That is also from Cawangan Kualiti Penjagaan Perubatan under bahagian risiko surveillance in KKM E1, bahagian perkembangan. Because that's what we did for you. Okay? So banyak kerja. So you kena gunakan duit tu. Dia dah habiskan 16 juta and mereka guna APPL juga. That means it's still not enough. Okay. So this tells you it's very much cheaper. Multiple studies basically from Dennis and team, and you can see what they call it is quite effective. So memang it is one of the advances yang kita ada. So you spray 5 centimeters from the wound, terus tu 1 to 2 spray saja, wait for 5 minutes for it to absorb, and then close up basically dengan melolin ke apa semua tu. They come back to you twice a week aja. Tuesday and Friday, Monday and Thursday, macam tu. Tak payah every day. Alright, so you can manage the patients better. You don't need to do it so often. Okay. So if you look at a bit of local hospital experience, nak tunjuk gambar sikit sebab you belum makan lagi. After makan muntah pula. Okay. So you nampak, they use a lot of things, collagen foam apa semua tu for this patient semua tu. Tapi dengan spray cukup dah. And spray ni buat dekat rumah aja. Datang jumpa kita hanya sekali seminggu ke apa, cukup. Alright. So you can decentralize your patients. Same thing dengan ni juga, another patient also for DFU. After pakai calciplix and secondary foam biasa to cover tempat tu. You can see the improvement much better at the dorsal aspect. Here another patient, same thing. Tapi why this one take a bit longer? Because dia pakai balik Japanese slipper apa semua tu, tak pakai proper footwear. So dia bukan holistic. You tengok luka je, lubang dalam tu. Susah juga. So you can apply. So use your calciplix, spray dekat tempat tu, it starts to heal faster. So you have to have all these additional things, even interdigital spaces. Basah kan, masa berwuduk semua tu kena bersihkan tempat tu semua tu. So apa you all buat? Ada ke? Ramai tak bersihkan in between the toes tau. Dia letak atas basin macam tu, cuci, dab. Hari Jumaat I beritahu you. Because for wound, you kena discuss dengan ustaz, dengan kadi semua tu. You tak boleh seorang aja. You can be whatever religion, tapi you are Malaysian. So in Malaysian, you kena tahu, boleh ke dia buat ni macam ni semua? Air kena masuk, dressing akan rosak ke apa semua. So ustaz kata apa? Tak apa, boleh jamak aja sekali. Ataupun buat syarat saja. You have to know. Tell the patient. Patient tak ada masa nak keluar cari ustaz beritahu ke apa. So you kena bincang dengan ustaz and tahu which are the one yang fatwa-fatwa dah keluar semua tu yang mereka boleh buat syarat. Because it is a wound. Jika tak infected, masuk kuman, bakteria. Alright? Because 5 times a day you putting water on top tu kan. Teruk sikit. So you kena buat syarat saja. And it can be done. Memang ada dia punya what they call this, peruntukan dia. So you kena tanya semua benda ni. All this important. Same with this thing also. Basically you can see callosity over the area. This patient is nicely walking. Alright? So sebab itu you kena jaga. And then it was an ketamine, silver spray. Satu lagi orang suka pakai silver. Silver. Tak ada infection pun silver. Why? Wear lah silver for yourself. Put extra pearl inside there. Borneo pearl kan? Instead you put silver on the patients macam tu. Silver challenge is 14 days. After 14 days the infection should clear. If it's not cleared, you chose a wrong item. Your fault. When you do dressing, dia bukan spinal reflex. It's using your brain. So I was very happy Dr. Max informed just now. Brain of Borneo kan? Pakailah brain tu. Janganlah just slogan ke apa semua tu. So you all kena bagi echo training to everyone to do that. Same thing dengan ni. Basically here. Why is it all what they call it thick and callous ini? He's still walking. He should be walking on the heel. Like this. So what do you do in the clinic? Patient masuk. After dia buat dressing, dia keluar tu. Dia pakai crutches ke apa semua. You keluar ke pintu luar department, tengok dia. The crutches be like this. They don't use. I tangkap banyak dah. Kasut pun sama. Datang jumpa you pakai kasut. After that, high heel. Why? Pendek. Tak apalah pakai tangga lah next time. Alright? So they tak follow you begitu. So you must check on all them. Alright? Same thing ini. This one why I have to show? Because this carbuncle is one of the very few carbuncles which has been sorcerized completely. You all buat, Dina buat clinical kan? Most carbuncle apa? Kuning masih ada. Dia tak betul-betul buat. Betul-betul buat, cepat turun, cepat habis. Less than 2 months, tutup dah. Alright? If you tak buat betul-betul, kita kena clear infection dulu. After that, baru start to heal the wound. So it takes much longer. Okay? So when surgical buat socialization, kena completekan. Tapi I can't blame the surgeon. Sebab yang buat tu, MO. Baru belajar. So dia dah cakap dah masa makan ni time ni. Habis dia keluar lah tu. Which you all know right sekarang ni. Banyak alasan kan. Sebab tu I suka masuk OT. Tapi yang leceh ni kena masuk OT, kena tukar baju. You know? And tukar baju take a long time. After that, they give you a slipper which betul-betul you jalan dia akan macam ni pula. How you operate? Until surgeon kena beli their own slipper. Untuk pengarah hospital pun dia bagi slipper yang cantik tapi there is no strap at the back. Alright, so it's not a proper shoe. It's like a slipper tu. Cantiklah color semua. Now after after our COVID kan, mask pun cantik, baju pun cantik, your scrub pun cantik. That's why I like all your green dengan blue sekarang ni. Because dia same. If katakan kita beritahu it's not a program macam ni, all of you all will wear the different scrub. Pink, purple, green, blue. Yang RM10 je kan. Nama lain, Amy. Nama Sharifah Mastura. Tiba-tiba Amy pula. You don't even know. Sama macam you nama kan dekat WhatsApp. Tengok siapalah orang ni yang hantar gambar tu. Tengok gambar ada kucing. Ada bunga, ada kopi kan? Latte, the flower tu. So kita tahu who is actually the person. Alright, so you can use heparan sulfate actually as for rapid granulation. Now, the last part is on negative pressure. All tahu bekam kan? Okay, so basically you're very close to Mindanao. So sure mereka buat bekam-bekam semua tu. So we have all those. So when Maurice Quas and his Agenda came out with this, in 2008, kita ada World Conference dekat Toronto, Canada. I was there when they came out with the 4th generation vacuum estate closure daripada KCI. KCI has become under SLT, then masuk 3M, then jadi Solventum dah sekarang. And they actually do all this, what they call it, pressure suctioning. So this particular product I'm talking is not about KCI vacuum system, but a different system itself. Okay, and you can see basically it promotes perfusion, macro and micro deformation, that means bringing the edges together and also promoting granulation. So their effectiveness, quite effective basically. You nampak dia betul, rapid rate of granulation and also achieve your result. So I move the patient from ICU, CCU, CRW or even from ED kepada ward biasa je. Because after you use this dengan installation, air dia masuk. Tapi tolonglah janganlah masuk povidone. If not, I'll come back again and pukul you dengan povidone tu. Alright, please. Nobody uses povidone for installation. It's a very expensive device, Altavac. Now this is Genadine punya tu. So kita pakai basically apa tu hypochlorous, yes, boleh guna. Kita boleh pakai nano copper ke apa, okay. This two is quite fine to be used. Protosan pun boleh juga tapi mahal. Itu aja beza dia. Alright. Don't use apa tu. Even if you langsung tak ada benda, instead using povidone, pakailah you punya distilled water. Cukup. You ada 1 liter punya kan, just apply, it will go in. So what happens basically, negative pressure, dia akan instill the fluid, soak dalam tu for at least about 6 to 8 minutes, and then after that they suck out, stuck negative pressure for another 4 to 6 hours. So every 6 hourly dia ada installation dengan dwelling dekat tempat tu. That means tak payah misi lagi dah. You boleh rehat lagi. Ada siapa-siapa cakap terima kasih ke? Tak ada kan? So bila mulakan wound care pun dekat Malaysia in 1998, tak ada orang pun cakap terima kasih tau. Dulu you buat dressing berapa kali? You tak ingat. You buat dressing, maybe Dina might know lah, I'm not sure how old she is. Tapi you might have known, you buat dressing berapa? TDS, QID, daily. Sekarang tak, 2 kali seminggu. Paling kerap, 3 kali seminggu. Very rarely you buat daily lagi dah. So, sama-sama lah. You're welcome. Okay. So when we started that, memang, if you don't believe, you can ask the Thai professors, Prof Apira, Prof Apichai, semua tu. They will tell you when we started, we were doing all these things. Now basically with advanced products semua tu, we only basically do very short periods of dressing semua tu, and the wounds heal faster. Okay? And better, what do you call it, healing rate. So with NPWT ni, you can cleanse the wound, you can clear the infections, you can start closing the wound, increase perfusion, and also what do you call it, remove the exudate semua tu, and promote your granulation. So even the IWJ, they say wound journal, also mentions about the NPWT ID. Okay, so this time I'll show you basically on a different kind of product which has just come in from Genadine semua tu. Even in orthoplastic surgery, systemic review meta-analysis, they said yes, NPWT ID is more superior than NPWT biasa or any other conventional dressing. Okay, so sekarang bukan dressing lagi ya, you pakai negative pressure juga. Alright, tapi with installation and dwelling itself. Okay, and these are all studies, bukan saya yang cakap. Semua Mat Salih, Mina Salih beritahu. Okay, this is the product daripada Genadine, which is from US. The previous one dah ada dah. Now all of them are playing with the foam. Dia tukar-tukar foam semua tu. So you find you simpan the installation fluid dekat sini. One side will be the chamber atau the what you call canister to absorb back basically. And then when you put on the patient, kita hanya pakai less than 2 weeks saja. Alright. So you can see here now they're using the green dressing. If you look at KCI, dia pakai granule foam. Then dia pergi kepada cleanse choice. They tukar the foam accordingly. Alright. So you apply semua tu, now it becomes a medical device pula. Alright. You're going to apply. So it's no more dressing saja. Dressing is kuno bila kita started in 1998. Ada lagi tu tapi kita ada additional. You also don't forget good wound care. You kena cleanse, you kena debride. You tak debride betul-betul, you can put whatever dressing, is not going to work. Alright. So sit down and do. There was one patient, bukan apa. Dia simpan the patient for berapa minggu tu. Debride sikit sejemput je sebab dia tansri. So bila I pergi sana, I just duduk sekali je debride. By the next TCA, clear, close. I showed Dr. Ananda tadi. So I terus keluar taring, marah all my MOs. Alright? Yelah, you all got postgrad. One fellow doing master lagi. Tapi you don't sit and debride the patient. You just hope the dressing will manage the patient. Just because tansri. Tansri, awak buat je lah. Agong pun saya jaga. Nampak gambar dia? Ini bukan sebab nak tunjuk you tau. This one is because I kena pakai jika sekarang, because what happened in Miri tu, when I was giving a lecture dekat Miri, tiba-tiba tuanku kata, okay, tomorrow morning I see you. I tak ada kod apa-apa tau, and you tak pakai medal, dia marah. Halo, mana saya punya medal? Itu hari I pakai colonel punya baju untuk petana awam. Nak terima watika, lupa tempek satu medal. So sekarang every baju ada medal. The first thing dia tanya I, you buat colonel apa ke? Dato Dr. Hari, where's my medal? Okay. Tuanku, yes, I just wore today. Tuanku tak ada. Apa dia jawab macam mana? So I have to wear lah. The one I inform to KKM juga. Sorry kena pakai. Sebab agung dan raja dan negara kan. Okay, so kena pakai tu. So usually important. Alright. So untuk agung pun sama kita buat. If sakit sangat ke apa, kita akan what they call is go under, basically bagi what they call is GA ke apa, and we do the thing. So you all choose the one. Make sure you cover the acute pain survey. So katakan apa tu what they call is Tun Haji Ji nak juga, you kena buat jugalah. Tapi janganlah pergi congkil dengan dia tanpa pakai apa-apa. Okay? Ataupun you buat dressing lebih-lebih macam tu je. Tak baik-baik itu dia pindah lain tempat pula. Okay? So you can see basically it helps in terms of the microdefinition, healing semua tu. Your vascular internal growth factor pun akan tambah semua tu. So urun macam ni dekat ward. After that when we use it, basically 3 cycle aja. Each cycle is about 3 to 5 days saja. So within that 2 weeks tu dah keluar kepada bahagian ni, hantar balik rumah. And then patient come to us. Alright, as an outpatient case. Sebab you lagi banyak infection dekat wound. And then you got burst abdomen with SSI, surgical site infection. Okay, so we got a global surgical wounds group. So bila kita letak ni, nampak dah clear, cantik, merah dah. It's already starting to bleed. Then you should letak simple alginate dressing with silver ke apa semua cukup, and send the patient back. Then they come back twice a week macam tu. Ataupun you buat domiciliary nursing. You send the patient for home nursing sendiri. Okay, another case of infected right leg AKA stem. Kita pakai 3 cycle aja. Nothing is more than 3 cycle. So short period saja. You push the patient out like this already, send the patient back. Don't keep in the ward. Why? Bed occupancy. Never enough beds in any part of the hospital. Sama, endometrioma. Also another thing also juga. Sama juga. So what we did basically, clearing nampak, cantik dah. So what you're doing here is moving a chronic wound to an acute wound so that it starts to heal. Okay? And then you can stitch back, you can close back, you can graft, you can flap, you can do whatever you want. Masuk kepada lecture lain pula, principle of wound closure. Okay? So if let's say plastic, dia akan buat the whole range. Orthopedic, dia akan buat SSG. Okay, split skin graft, or maybe a full thickness graft if some of them pandai. If not, they will basically just do a normal what they call SSG saja. Plastic will do the whole stretch. Okay? Sama dengan ni, look at this patient. Total abdominal hysterectomy. The problem wound care dekat HKL lain sikit kita tak tengok adult saja. Kita tengok pediatric, kita tengok ONG semua. And kita tengok respiratory juga. Kita cover the whole hospital. And kita cover IJN, heart juga. So memang refer ke kita juga dekat IJN. So macam you all pusat jantung and all that. So memang kita cover. So kita bukan 2,500 katil, kita tambah lagi katil dekat IJN juga. Okay, we have to cover that. So nak cantik merah dah. So once it comes up, boleh nampak vertical closure. Alright. So fast and quick, 2 cycle aja. Only 2 times you tukar. Dah. Pasang, tukar satu lagi. Dah, habis. Okay. So another product yang baru keluar dari Taiwan ni is Fespixion. This one is actually for clean wound. So that means basically dia actually application tapi mahal. One tube is about RM1,000. 1,234 ringgit. Tapi it's coming from what they call is Planktonus embryonicus and Centella acetica. It's the only product coming from traditional punya barang. And this has already what they call is been registered under NPRA. So that's why I hope later on UMS bila dah berkembang dalam 5 tahun, 10 tahun ke apa, what they call it, so that you will actually also do a lot of studies on traditional medicine. Banyak benda in Sabah, Sarawak, all that, a lot of traditional things yang masih bekerja lagi. Okay? Mak-mak suruh letakkan daun papaya lah, apalah semua tu. Why? That was where the daun papaya came out, what they call it, with papain. That's how you came out with your pepase and prolase. It's from there, papaya. Last time we cut and put on top basically. Now we already have prolase dekat hospital. We're giving you makanlah untuk bengkak. Alright. Until after that, I was the first person in Malaysia to start using the pepase tu untuk tekak. Because inflammation kan. So I cakap dengan dia, jangan gigit. Suck. So the effect. So from that now, everybody has been doing it. Because dulu I timbalan keterjabatan for outpatient 20 over years ago. So at that time kita mulakan. How many of you ada anak? Tak ada anak? Beberapa orang je angkat tangan. Lain semua tak nak anak ke? Pas balik kepada isteri balik, masuk balik. So you see when your anak tu, you tahu tak, you boleh pakai sirap Benadryl Peach tak? Atau sirap Fenagan untuk less than 2 years old? Cannot. Why? Respiratory depression. Who found out? Me. Because Timbalan Ketua Jabatan for Outpatient Department, and that time my first anak, 22 tahun dulu. Okay, she's now lawyer dah. Okay, so what happened when she was a baby? First anak kan, semua check. Everything we check. Check, kata, oi. Then tiba-tiba kita jumpa advisory. I remember advisory daripada US. US FDA has stopped Phenergan. Phenergan promethazine we used to use for coughing, for vomiting, for stomach pain, for diarrhea, for anti-emetic. Everything kita pakai. Even for flu. Kata, oh selamat compared to Benadryl Pits, diphenhydramine. Okay? So when that thing came out there, basically first thing when besok next day, all my pharmacists kena bunuh. After dia bunuh, dia pun naik ke syurga, dia tanya dengan KKM Pharmacy. After that baru keluar surat tu, oh ini sebab anak Dato' Hari ni, masa tu Dr. Hari je lah, hari biasa je. Tapi hari-hari minta dengan dia kan, dia keluarkan sekila, they stop the whole thing. This happened 22 years ago. Okay, when my first one was born. Tapi tak pernah cakap fenomena hari, ada ke? Tapi bukan syok sendiri ke apa. Even your, what do you call this, what do you use for your children tu? Your, what do you call that, fluid yang untuk berhentikan, I'll come to me later on. That also we found out ada, what do you call this, alcohol dalam tu. You have to find yang betul-betul yang tak ada alcohol, baru boleh guna. Takkan nak bagi alcohol untuk budak baru lahir tu, infant lagi tu. Okay, so these are things you must check. So this one same thing, first picture presented in 2023 in the IWGDF Congress dekat Hague, basically in ISDF, and they showed that M1 receptor goes down, which is inflammatory receptor, and increase the M2 receptor. So we started doing more studies on that, everything on that. And one of the things that we did on these 5 patients too, we found 2 out of them terus tutup. And they can go back and use the dressing. So even though it's expensive, because only 15 grams, $1,600. But you buy 2, you dapat 1 free, becomes 1,200 ringgit. Tapi still mahal lah. Alright? So what happens basically, first, HbA1c 5.6. Sugar must be low. He'll heal better. The other 4 cases, sugar high. And then if let's say ulcer duration is early, refer early ke apa semua tu, the wound basically you find tutup terus, less than 1 month. Okay? So now we are doing another 200 cases. We have 100 something cases dah buat dah sekarang, so we're going to finish 200 cases. So one of the centers that you have to have, let's say training ke apa semua later on, you must do a lot of research dengan training, and you must do a lot of what they call it publication juga. I'm not sure about you all, tapi I tengok for my professorship semua tu, I perlu dapat 50 markah every year. 1 buku is 50 markah. If not, 1 publication is 5 markah. So kena buat 10. If not, you have got 20 markah if you do other things. Depends on the level of publication ke apa. You maintain tu, baru you maintain professorship. Because professor tu is actually for world. Okay? Bukan sebab I nak keluar daripada universiti, I dapat professor. Itu pun berlaku jugalah. Tapi tak apalah. Bukan semua tempat lain. Singapore, some of them 70 years old pun associate professor lagi. Tak jadi professor pun. Okay? Macam Prof Aziz, neither. Dia still associate prof. Okay? Prof Jeff Sussman, 70 lebih baru jadi prof. Full prof, If not, they associate prof sampai pencen, after continue working pula. Now, let's look at some of the things new. This is our Wound Training Education Center dekat MHKL. So, memang kita akan buat virtual reality. There's 2 rooms. By this October, we'll have virtual reality. You pasang the thing, and then you belajar how to debride the wound ke apa semua tu, and then baru pergi klinik and buat debridement. Okay? This one. This is our Wound Training Center semua tu. So this is different rooms yang kita buat apa semua. Now dah update. Lounge area untuk you all duduk lepak selepas conference ke apa semua tu. This is the conference suite tu, di mana we have got apa tu TV apa semua tu. 60 people can be here. That one is the interactive board. So dekat wound tu you boleh just expand, tutupkan ke semua. Semalam petang pun I was there untuk this one. These are our stations for what you call is training apa semua tu. Alright. So our skills lab apa. And then we have got another set of 4 rooms apa semua. One on times. One on what they call is wound hygiene, one more on malignancy, one more on basically on what they call is macrophage regulation. So each room ada dia tema dia juga. So one whole ward jadi Wound Training Education Center. So after this, plastic, vascular, surgical, whatever, all akan buat dekat sana. So you need that kind of skills lab. I visited a few places, even what they call is Universiti Teknologi Sarawak and a few others, and these are some of the things they're looking at. So these simulation labs are important juga. We have 2 simulation labs and 2 education labs semua tu. Alright. And then this hyperbaric, basically, we're not doing this monoplace. Tapi setiap kali buat monoplace, 500,000. So kita buat modular. I pasang 2 dulu, baring and duduk, and then I pasang 2 as I dapat duit. Sebab prinsip dekat KKM is, dia tak pernah bagi you platinum card. Dia bagi you normal, what they call this, plastic card tu, and then after end of the year, kita, duit dah habis, koyak card tu. So you have to buy sikit, and jadi lama-lama jadi bukit. Betul kan? Okay, so we can have 12 chambers dalam tu. So we put 2 sekarang dulu under next budget tu, which is this year juga, and then we will add on 10 more semua tu. Okay? And then basically after that, my EP akan happy guna, my plastic guna, vascular guna, semua guna. So 12 pun tak cukup. They actually want to put a huge one for HKL. We can actually find the spot later on to tambah lagi. Okay? Now, this one just to touch, because I find a lot of people going around saying they are regenerative medicine AI specialists. Chatbox, ChatGPT, Gemini, Notebook LM is machine learning. It is not AI. The proper AI is actually with prescriptive analysis. You tengok what you call this, katakan you tengok this particular person, you see, okay, what particular dressing. Now, by using basically povidone iodine, 11% will basically achieve epithelialization. However, by using what they call this superoxidized solution or hypochlorous solution, 97.65% will heal. So it is suggested, first choice is that nothing available, please use distilled water ke apa semua. That is prescriptive analysis. This particular case, please do not use silver dressings because silver can cause agarrhea and agarrosis in 74%. The best way to use is a particular dressing which might actually help in terms of as an antimicrobial, maybe an activated charcoal dressing with basically a secondary dressing of foam because the extrude levels are high, and this is proven by these references. That is AI. Bukan Google made fast. ChatGPT is Google made fast kan? Cepat-cepat dikeluarkan semua tu. Oh, you surprised lah. Hebat juga tau. Whatever you do dengan internet tu, dia akan keluar. You buat apa-apa dekat universiti keluar juga. Because suddenly I put my wife's name and say, what did she do? I just put her name and carilah purposely kan. Nakal kan hari tu. So tengok Datin punya nama, I masuk nama je. Dan tiba-tiba tengok ada one study on starch dengan apa semua tu. So I pun cakap, hey, who is this Nisha? Orang salah ni kalau apa kan? She said, no lah, that's my master's thesis lah. Oh, iya kan? Okay. Dia pas starch. Dan dia kata dia pas starch. So something on starch, because dia food technologist. Then she did masters in IT apa semua tu dekat USM. So basically tengok, even the thesis comes out inside there, in the AI. Quite surprising. Tapi that is not prescriptive. It never told me why you should marry her. And whether you should marry her. What can she offer? Tak ada. That is the AI part. Barulah itu artificial intelligence. If I just give you whatever evidence or whatever what they call this information, it is machine learning. So we are also launching the AI punya paper in September ni. Okay? And this is the one. So I have done this thing. So very nicely I put up this thing basically because global paradigm shift, wound management specialty and recognition. So when I went for the presidential election semua tu, Dr. Ananda was with me in Abu Dhabi semua tu during COVID. So before we go ke cocok, sampai dekat sana cocok lagi satu kali, 2 hari sekali cocok lagi. Every time you ingat you tak boleh pergi assembly. You tak ada ke assembly you kalah tau. So cocok keluar 2 hari cocok je. Cocok menangis. Alright? Akhirnya the best part kita menang. We won compared to the 2 US bids, Australia and Mexico. So Malaysia won 54% of the votes. That means you have got buku-buku yang saya bagi nanti ke library ni memang dah sampai ke South America, North America, Europe, Africa, semua dapat dah sebelum ni. Sebab ini kerja-kerja selama beberapa tahun. So this is the conference 23-27 September. Those who are interested, tolong datang because World Union started in the year 2000 in Melbourne, 2004 in Paris, 2008 in Toronto, Canada, 2012 Yokohama, Japan, 2016 Florence, Italy, 2022 in Abu Dhabi, 2026 in Malaysia, and after that 2030 will go to the Americas, either America atau Brazil. So this is the only time in 30 tahun ada di Malaysia. And I rasa takkan ada balik di Malaysia for many years because all the country tak cover juga. And you have to go for elections. Dia bukan just bagi kat you aja. Tak ada bidding biasa semua. In the bid you have to win as the president. Okay? So hopefully you all can come sebab dia dekat KLCC. So harap-harap ada. So far there's already about more than 2,500 delegates dah. Speaker more than 400 plus speaker. 90% is overseas. Only 10% Malaysian speaker. Okay? Speaker alone is about 60 over countries. Delegates more than 100 countries dah. Okay? So hopefully you all can come for that. This one is to go and tell you. I want to ask Dr. Max also. Has emergency medical services in Malaysia received a World Health Organization award before, according to your knowledge? No, right? Okay. Because why? I always show this last picture there. This Dr. Nazni from IMR. Dah pencen, masih bekerja, tak boleh lepaskan lagi. Saya kata saya kerja, you kena kerja juga. Dr. Fadila, dah pencen dah, Dr. Fadila. This one is the award from the World Health Organization. Dr. Lee John Walk Award in 2018. Wound care management in terms of usage of maggot debridement from IMR used in HKL. So myself and her, both of us here, memang what they call this, menang this award. So this is a wound healing award, basically not a wound healing award, it's from WHO. So it's, and you just think, benda tu kecil je, ayolah WHO dia bagilah sikit tu. $100,000 punya award. So me, Dr. Nazli pun banyak dapat duit juga. Tan Si Syam tahu. He flew us to Geneva to receive this award during the 71st Assembly of the World Health Organization. So wound care has got World Health Organization award. I'm not talking about any specialty stuff, because sometimes specialties tengok, if new specialty, baru budak keji, tata benda, apa semua tu. Tapi I'm very happy with UMS. I think Dr. Max, your team with Dr. What do you call this, Dina and all that, I'm very happy basically. And all of y'all lah basically. Azmi semua what do you call it has done wound. So all of y'all basically tahu what do you call this. Samsul also was there before. So all of y'all have done this, so you know basically what do you call this is important. So we have got an award for that. And we use 50,000 US from there to help patients to dapatkan dressing, barangan maggot therapy and all these things. And we use maggot from 2003. Now kita buat leeches, this year buku leech akan keluar. And kita dah mulakan study on tilapia fish skin. Quite effective juga. We'll do the publication after this also. Okay? So I think with that, thank you very much.
Thank you once again, Prof. Dato Dr. Hari, I think for such a valuable insight and very informative presentation. So I'm sure the audience have some question to ask to our speaker this morning. If there is any question, I'll pass the mic to you. Any question? So may we have a question from our participant? Okay, let me ask one more time. Is there any question from the floor for Prof. Dato Dr. Hari? Nah? Yeah, I think they agree with you. And if there is no question, then let us proceed with the next agenda this morning. Okay. But before that, once again, thank you, Prof. Dato Dr. Hari, for such a wonderful presentation that brings to the end of the lecture. But before that, I would like to once again invite Prof. Dato Dr. Hari to come on stage, and together with the Dr. Max and Dr. Ananta to deliver the token of appreciation. Okay, ladies and gentlemen, this is the token of appreciation presentation. And once, please remain on stage because Mr. Baharin will also deliver another token of appreciation to our speaker this morning. Just remain on stage because next we'll proceed with the wound kit delivery presentation. So I hope all the representatives who receive the kit will be ready as I will call upon your name. All right. So for this session, Prof. Dato Dr. Hari will present the special wound kit presentation to the representative. And the first one, I would like kecil tulisan dia. Okay, I would like to call upon Dr. Muhammad Azmi from Hospital Kunang. Okay. Okay, next I would like to call upon Dr. Haji Samsul Bintua from Hospital Papar. Dr. Lydra Phillips from Hospital Baluran. Next, I would like to call upon Dr. Muhammad Sobri from Hospital Kuala Penyu. Dr. Ram Santil from Hospital Tambunan. Dr. Muhammad Afnan from Klinik Kesihatan Tulip. PPP Andreas Ansiban Moinin from Klinik Kesihatan Sandakan. PPP Syawal Aming from Klinik Kesihatan Tawau. Next, I would like to call upon Dr. Nur Nadira from Pejabat Kesihatan Kawasan Tuaran to receive the kit for KK Tamparulid and KK Kundasang. Yes. Next, Pasukan Penjagaan Luka Hospital Universiti Malaysia Sabah. I would like to call upon Dr. Abdul Jabbar. And last but not least, Jabatan Kejururawatan Fakulti Perubatan dan Sains Kesihatan presented by Dr. Dina Claire Thomas. Okay, and then I would like to call upon everyone for the photo session. I think the photographer will shoot from here, so. Oh, okay. And for that, I would like to call upon once again all the recipients